David requests a discussion with a surgeon prior to deciding whether or not to be randomised into PulMiCC.
Hello, David and Helen. I see you're clutching all the information about the PulMiCC study. Okay. Was it helpful reading through the leaflets and watching the DVD?
Yeah, that DVD is very good.
Very helpful.
Yeah.
Yes.
Okay.
Yeah.
Well, what I'd like to share first, thank you very much for going through all those tests. And all the tests have shown us that we are still uncertain as to which treatment approach to recommend for you.
Right.
Okay. Which means you are eligible for the PulMiCC study. In fact, this study was designed exactly for somebody like you, where it really isn't clear which treatment approach to take. So do you have any other questions today? Or are you happy to go ahead and sign up the consent form for the study?
Well, to be honest, we're not sure that we're totally happy with the option of just waiting for something to happen.
Okay.
And although there's good information here and the cartoons and everything on the surgery, we were wondering, would it be possible for us to meet with one of the surgeons who might be doing this operation?
Absolutely, yeah. Absolutely. I mean, there's two things there. One, I work very closely in this network with Professor Treasure. So he's our local expert. He would be the surgeon undertaking the operation.
Oh, that's good.
And in fact, he's part of my local MDT, so he actually knows your case very well.
That's good.
So I'm very happy to arrange that appointment. But I'd like to pick up on something you said. You mentioned about waiting for something to happen. And I can see how that's how you see your disease right now. But actually, this is all about trying to understand why this has occurred. And although we can only see 2 secondary lesions right now, the difficult concept is that those seeds must have been sown when you first had your original bowel cancer 3 years ago.
Really?
Because to have secondary disease now, it must have been spread at the time of your primary cancer.
I see.
I see.
And all this time they lay dormant. They clearly weren't killed by the chemotherapy that I gave you. And so one of the reasons the PulMiCC study's been designed is those 2 lesions may not be your only lesions. And therefore we're not waiting for something to happen. The uncertainty is about, are they really your 2 only lesions?
Yeah.
Or, as time goes on, may other lesions become apparent, more secondary disease, either in your other side of your lung, perhaps in your liver. Or it may well be they are the only 2 lesions, but actually they've been growing very, very slowly, and only now we can see them on a scan. And actually they may keep growing slowly, maybe in another year, 18 months, they may not change significantly in size at all. So what we're uncertain about is offering something as radical as an operation on your test to remove them, when actually we don't know what the natural history of your disease will be.
That could be a waste of time.
Exactly.
Yeah.
But talking to Professor
Treasure, yeah.
that's then not going to make a difference in terms of how I'm going to be if I should need treatment at any point.
Well, again, I don't know exactly how long these have been growing, but I know I've been monitoring you every 3 months, and the first abnormal test was just a month ago. So this is the first time I've been able to scan you to see something abnormal.
Yeah.
I wouldn't imagine that over an extra couple of weeks that's going to change your clinical situation significantly. But actually it's such an important decision you're making that I think those 2 weeks are critical, that you invest that time in meeting Professor Treasure and make sure you're happy to make the right decision.
Yeah, sure.
Makes sense.
If I felt time was of the essence, I wouldn't offer you this treatment option of active monitoring.
No. Fair enough. Yeah, fair enough.
Okay. So how shall we best move forward? Shall I get on today and organise an appointment for you to meet Professor Treasure?
Please. please.
Yeah.
Yeah, thank you.
And then we'll take things from there.
Sure. Yeah.
Okay,
Okay.
Thanks.
All right.
thank you.
Mm.